Welcome back, scholars. I hope this video finds you well. I'm going to be lecturing on chapter 13, stress, coping, and health. So what we're going to talk about in the first half of the lecture, stress. We're going to talk about uh, the biological or physiological effects of stress. We'll talk about the psychological, and then we'll also talk about the kind of the behavioral piece of it, right? So how does that affect our behavior? So we'll talk about the emotions that are tied to stress, how those emotions are elicited when we are experiencing stressful situations. We'll talk about the um, biopsychosocial model of stress and how all of those different components are kind of interactive with one another as we experience stressful events. And then we'll move into coping. We'll talk about um, some kind of negative ways to cope, and then we'll also talk about some positive ways to address stressful situations. And the last thing we'll mention is the effects of some of the things that we do that impair our health and can lead to long-term um, negative outcomes and lived outcomes for us. So, stress is one of the most common things that we experience in life. We experience it we experience it every day. There are daily hassles that we have, and the stress is one of them. Driving to work or going to class, making a decision on what you want to wear for the day. A conversation you have with a loved one. All of those things do cause and can create stress. So we'll go through um, this pretty quickly and kind of address some of the key concepts and components that we as psychologists study when and regarding stress. So just something that you should think about. You know, as a college student, there are lots of stressors in our life. We're bogged down with heavy schoolwork or heavy course load. You have obligations outside of school, just the interactions you have with professors. All of those things can cause you stress. And I want you to think about and this question. Do you agree that stress can cause physical illness? And many of us, if we were to think back over our life, we have had stressful situations where there was a lot of stress and it caused us to feel uh, ill. Physical illness like, hey, I feel like I'm catching a cold because I've been stressing over one particular thing for a very long time. And then, think about some of the ways that you do manage your stress in your life. And we'll talk about some healthy ways to cope. But again, we want to be mindful of the idea that, stress can kill if not managed well over the course of our life. And there are certain um, groups of people in our communities and in our society that experience more stress than other types of groups. And it's important that we try to support those individuals. We'll talk about the different ethnicities, those in different socioeconomic statuses who may experience stress on a different level and at um, different lengths of time and durations. So, how do we help as a people help those who experience stress on a bigger level? Okay? So, the nature of stress. What is the nature of stress? Obviously, stress is an everyday event. We have these routine hassles that can have significant effects if they kind of accumulate over the course of time. And the cumulative effect of stress does play a big role. We're having to go to work. We have occupational stress. We have school stress. We have relational stress with some of our friends and family. All of those different stressors in a cumulative way can create great strain and create some physiological and mental health issues if we don't handle them in a timely fashion. Um, so the way that we measure or think about stress is through the biopsychosocial. And this model holds that physical illness that we experience is caused by a complex interaction of our biological, our psychological, and our social cultural factors, right? And so when we think about physical illness, and we talk about, how stress can cause illness, all of these different factors do play a big part, right? So stress, in and of itself, defined as any circumstance that threatens or is perceived to threaten one's being or well-being, excuse me, and burdens one's coping ability, right? And so when you have so much stress, your stress does affect your body physiologically. It can also affect your psychological response, your emotions, and the environment that you live in can also affect stress levels and eventually uh, can lead to physical illness. All right, so we have to be mindful of all of these different factors that again interact with one another. So if we can reduce the biological effects or the psychological effects of stress, then we'll be able to mitigate some of the likelihood that we'll be and become physically ill. When you think about stress, I've done a few, did a little reading on, what groups of individuals experience the most stress, especially regarding race and ethnicity. On the left-hand side of the screen, you see that, many of the stressors take the form of, maybe economic difficulties, occupational strain, low status or low social status, economic social status, neighborhood instability. So am I living in a neighborhood that doesn't have all the resources that I need? Do I have a grocery store in my neighborhood? Do I have proper lighting? Is my neighborhood, does it have a high crime rate, right? Discrimination for those who, face discrimination and prejudice. Again, that also becomes a stressor because we're dealing with um, relationships with people that, these implicit biases that individuals have they respond to us differently. Um, and on a global measure of combining these exposures to those stressors that we talked about, we talk about occupation, finances, relationships, racial bias, and violence. Blacks, Hispanics, Asians, so many people of color reported higher levels of stress than whites. Okay? Moreover, Blacks, especially those at the low end of the economic spectrum, they report not only a greater number of stressful life events. So not only do they have more life events that happen that are really, really stressful, but also stronger responses to them, okay? And or what we call greater distress than whites in a variety of domains. So it's not that it's not that we have more, right? It's that we have more stressful life events and that we also have a higher distress, meaning, our environment is influencing us, our diet, lack of sleep, lack of time, lack of energy. That also affects our distress and how we handle stress, right? And our responses to the stress in our life. And so, how do we create an environment? I'm a community psychologist, and so we think about how we can create supportive environments where individuals don't have to uh, have and experience so many stressful life events. How can we provide resources and create interventions and a lived environment where they and we can experience life in a less stressful fashion? When we are thinking about stress and a stressful life event, there are and is a primary and secondary appraisal that takes place. Okay, the primary appraisal is just an initial evaluation of whether the event is either relevant, irrelevant to me, relevant but not threatening, or stressful. Right, so it comes into three different categories. So if it's irrelevant to me, then I'm likely not going to experience any stress whatsoever. Right, if it's relevant but it's not threatening me, then I won't experience stress. But again, obviously, if it's a stressful event, that means it's relevant to me and it's threatening, then I will experience some type of distress. Um, Say, for instance, my checking account's getting low, right? And um, I have a bill coming up, but I don't have enough in my checking account to pay for that bill. That's going to create, first of all, that's a relevant situation for me. And it is threatening because if I don't pay this bill, then I have the likelihood maybe it's my election bill or my utility bill, then maybe I don't have electricity, right? After we do that primary appraisal and we view the event as stressful, right? You'll likely do what we call a secondary appraisal. And this secondary appraisal is when you evaluate your resources that you have to cope and or your options for dealing with the stress. Right. So if we take the example of me and my banking account, and I don't have enough funds in my account to pay my bills, but what I've been doing over the course of getting my paychecks, I've been putting a little aside as kind of an emergency, right? A little cushion just in case I don't have enough, right? So initially the event is stressful because I don't have enough in my account, my checking account, but then I remember that I do have an emergency fund, right? So then I'm able to get into my bank account, transfer some money over from my emergency fund over to my checking account. And so now I'm good, right? So now I have some options in how I dealt with the stress. I have some coping resources, right? I have either the financial support or I have some social support of individuals who are going to try to encourage me and keep me positive. But again, we have to be mindful of how we deal with it. And that second area of appraisal is really, really important because if I don't have the resources to cope, then that stress is probably going to be maintained over the course of time. And when we have high levels of stress over a prolonged period of time, that can negatively affect our health physically and mentally. And we'll talk about those things as we move into the next few slides. Okay, so this is just a diagram of the different way in which we do primary, and secondary appraisal. So again, you have your stimulus event. And if that stimulus event is irrelevant to me and is not harmful, then I'm going to, again, have no stress. If it is relevant and is perceived as threatening, then I have to determine if I have the coping resources. If those coping resources appear inadequate or likely to be taxed, then I'm going to have a stress response. If those coping resources are to be adequate, then I have no stress whatsoever, right? So again, stress is very subjective. So what may be stressful to me when we talk about a stimulus event, what event might be really, really stressful to me may not be as stressful to someone else, and it might not be even relevant to someone else. So, we have, I'm in class as a student, my friend isn't in class, or maybe my friend is just out working, right? So the level of my stress when it comes to thinking about taking an exam is going to be different than my friend because they're not in class at the moment. So again, we're going to view things very differently based on where we are in life. Okay. Here are just some major types of stress. Change obviously is an inevitable type of stress, but we experience these all the time. Right? Frustration, internal conflict, change, pressure. When you're taking your exam, right? Taking an exam for a class, you're going to feel pressure, right? You have these expectations or demands that, again, one behave in a certain way, right? When you're in class or the pressure, you talk about peer pressure, right? Social pressure. You are making a decision on where you want to go eat, you and your friends. Everyone else wants to go to Red Lobster. You want to go to Olive Garden. But since everyone, all of your friends want to go to Red Lobster, you're pressured to make the decision to go to Red Lobster, right? It's just some pressure. Obviously, making changes happen all the time. A change in temperature, a change, a life transitional change happens, right? And so we go through these transitional periods, and that creates stress, right? When you made the transition from high school to college, or from middle school to high school, all of those transitional phases were changes. You changed your hair color. You changed your house, where you moved to, right? All of those changes can create some anxiety and some stress. Okay. When we think about the conflict and stressful situations, and especially the internal conflict that we go through, there are three different forms of conflict. You have what we call approach, and approach. This is an instance where you have two competing options, but there are two options that you're okay with, you agree with, you want. Maybe you can have both of them or either of them, right? This is a type of again, you favor both of them. So either playing tennis or racquetball, you can play either, but one way or the other, you still be satisfied if you chose spaghetti or pizza. Again, these are two options, but you're making those decisions based on how you feel in the moment, right? The other type of conflict is avoidance and avoidance. These are two situations that you don't want to happen, right? You don't favor either of these options, right? So if you're working a job and here are two things that you don't want to happen. You don't want to be unemployed, so you can't just quit your job. But if you stay in your job that is degrading, or they're overworking you, it's really stressful, then you have to make a decision on doing both, right? Painful backache or surgery. These are two things that you don't want to happen, right? But you have to make a decision. It's that internal conflict that's happening on the inside that again forces you to make a decision one way or the other. And then you have what we call approach avoidance, and this is an instance where when you make a decision, you have to take a risk on something else happening. So you want to date, you want to go on a date with someone that's attractive, you got to go ask them out first, right? But with asking them out, you also have to face the option of being rejected, right? So that's the approach and avoidance, right? Or when you're investing, you're investing your money into the stock market. It's a very risky investment, right? So you know that there's a risk in, again, investing and getting returns, right? So you get some investment returns, but there's also a likelihood that you could lose. You could lose money. So again, there's a pro and a con to that particular conflict, and it kind of goes on the same side of the coin, or on different sides of the coin. Excuse me. Okay. So again, when we think about approach, avoidance, and approach avoidance, let's think about this example. Okay. It says, again, when we are, as students, we do face these difficult choices. And again, that forces and creates some conflict on the inside. It says you have a big exam coming up, but you have also been invited for a weekend away with friends. They are both important to you, and you don't know which to choose. Okay. It says, which type of conflict are you facing? And one of the key words that you should think about here is the idea of them both, since they both are important to you, right? And so if they're both important to you specifically, then you have to make a decision. And then with giving those key words, then you should know which one to select. And in this particular example, you should have chosen letter A. Okay. Because again, the problem with this one is both of them are something that you want to do, right? They're a conflict, but they're over very important issues, right? It says, if you're torn between two appealing college majors, two attractive romantic partners, you may find the decision-making process quite stressful, right? If they are, not all that difficult to make the choice, like racquetball and tennis, they may not be all that stressful. But again, there are some more stressful conflicts that you have to weigh the pros and cons of. And so for this one, you're making a choice between two attractive goals, right? Studying for an exam and maybe making a good grade, or going and spending a weekend with friends. Both of those are attractive, but you only can make them a choice. Responding to stress, unit 313.2. All right. So in response to stress, there is a psychological kind of emotions that we elicit. You have also kind of a physiological response to stress, and you have a behavioral response to stress. And we'll talk about each of these in detail. We'll talk about these options here next, right? And when we think about responding to stress in a emotional way, right? Different emotions are elicited when we have and experience stress. So you have a kind of this potentially stressful event that happens, right? Maybe you're having a major exam, or you're going on a big date, maybe you have a financial setback. And this is going to lead to you making a cognitive appraisal of it. So you're going to make some kind of subjective appraisal, right? Is it, or do you perceive it as being a threat, right? Do you have any control over it, right? So in my particular instance where my bank account, my funds are running low, I don't think I have enough money in my account. If I have a savings account that's kind of my emergency fund, then I have some leeway, right? I have some way to go ahead and transfer some money over, and that gets me to the point where, hey, I can take control of that. So maybe it's not as stressful, right? And then you have these emotional responses. You have the physiological response and the behavioral response, right? And so we'll talk about those. But a lot of the emotional responses to stress can include some of these most basic ones, like apprehension, anxiety, sadness, grief. And then you also have positive emotions that can occur as well. We have a positive an event that occurs in our life. Maybe it's a graduation or prom. Um, those are stressful events, but they do elicit some, um, positive emotions when we think about it. When we think about positive emotions, right? You got happiness, love, gratitude, pride, kindness. Getting married is not inherently stressful, but it does create some anxiety and stress, right? And it may be good stress, right? But that promotes some form of resilience. Um, when we talk about positive emotions are those things that help to kind of alter our mindset. It kind of broadens our scope of attention, and they can increase our creativity and flexibility when we're trying to problem solve. And so when you have a negative emotion, it's sometimes almost really, really important to change that emotion to something positive, right? Because when you have a positive emotion, it can undo some of those negative, lingering emotions that we have, right? And when we can do that, we can turn the negative emotion to a positive emotion. The psychological responses to stress, again, are buffered, right? We turn those things around, and that kind of turns off some of the physiological responses that we feel, like the heart rate, respiration, um, the high blood pressure, all those things, right? Um, Positive emotions also promote rewarding social interactions, right? That help build a valuable social support and enhance coping strategies. So if I have love, I have support, I have pride, right? All of those things are positive emotions, and they help to kind of reward social interactions that we feel, right? And the last bullet here is a positive emotional style has many health benefits, right? So again, when you reduce the level of stress in your life, you're improving your mental health. You're also improving your physical health because again, your hormones are becoming more imbalanced, and those hormones then kind of control and are able to mitigate some of the things that we experience. Okay. Here are some of the effects of what we call emotional arousal. Okay. Uh, the uh, the Yerkes-Dodson law kind of resembles this inverted U. And this inverted U says that when we have an increased arousal associated with improved performance up to a point, right? So when we increase our emotional arousal, it increases to a point, and then with higher arousal leads to poor performance, right? And then there is an optimal level of arousal that depends on the complexity of each of the tasks, right? So if we're doing something like um, say we're playing baseball, right? And you know, we're in the first inning, not much pressure. The arousal is not that high because we're in the first inning. It's not that big, not that high of a emotional arousal, right? So, maybe we're here. This is kind of a simple, he's not throwing that hard, right? So maybe it's easy to hit the ball, right? But again, you start off with low arousal, you start off with low performance. But it takes a little more arousal to get your performance to improve. Okay. And this is your optimal level of performance right here at the top right? But you need a higher level of arousal if you have a lower level of simple, if you have a simple task, right? For the moderate task or the medium task, you need about a medium level of emotional arousal to again have optimal performance. And then on the third one, again, something that's really, really complex, all you need is a low level of emotional arousal, and that becomes your optimal level of performance there, right? So you can see, depending on the complexity of the task, depends on how much emotional arousal needs to be because it's an association, right? It's a relationship. So emotional arousal and performance, if you have emotional arousal and again, it's really, really high, and the complexity is simple, then again you have the optimal here, and each complexity changes the level of arousal and the difficulty level. Okay, or the level of arousal, excuse me, and performance. So we've talked about the physiological, we talked about the psychological effects or the emotional response. So now we're going to talk about the physiological response. And the physiological response is kind of referred to, we call the general adaptation syndrome. And it comes in 3 stages. You got the alarm stage, the resistance stage, and then you have the exhaustion stage. And this was first described by Hans Selye, okay? And what he said was, when we talk about adaptation, there's that first stage where we have an event, stimulus event that happens. It heightens something, and that is called our fight or flight response. So the alarm stage lets us know that something is happening, right? After we have that alarm stage, then we start to mobilize, our body begins to mobilize to be able to resist the stress response, to resist the stressor, right? And when we talk about the resistance stage, we start off with a low curve and then it rises as we begin to form that resistance, right? And it's a stabilized physiological change in which our body kind of recovers, right, from the jolt of energy that we got from the initial fight or flight response. And then if we aren't able to kind of handle the stress and it can't be overcome, then we become exhausted. Then our resistance is then lessened, right? That means that we're depleting a lot of our body's resources, the hormones in our body, the energy stores, and we'll talk about the different energy that's released through the pituitary gland, the autonomic nervous system, the sympathetic nervous system. Again, there is certain things that happen when we have that fight or flight response. And when we can't overcome the stress, then our body becomes depleted. Right? All the energy stores, again, the energy has to go somewhere. And if we're expending energy, we don't have an unlimited amount of it, right? And so we will eventually be depleted, and that's when we have the exhaustion phase. Okay, chronic stress is when, again, that stress can't be overcome, right? So chronic stress puts persons at greater risk of long-lasting negative physical and mental effects. And again, that is occurring because of the effect that we can't overcome the stress. We don't have the necessary resources. We don't have the necessary options necessary to remove the stress from our lived experience. And so now we have this long-lasting stress. It's chronic, and it's lasting more than we want it to. Okay, so here's just a diagram, right? And you think about the general adaptation syndrome, right? You have the initial response, kind of at a normal level of resistance. Then we hit a alarm stage, right? The fight or flight response, our body's kind of at a shock. It's at a shock right now, right? And then once we get shocked, our hormones are being released in our body to then develop some resistance to the stress, right? So now our body's kind of handling the stress. It handles it up to a point, right? And then as, again, that resistance to stress, if the time continues to go along and we're unable to overcome that stress, then we become depleted. Our physiological and the things that are happening in our body begin to wane, right? And then we get time here, and then if we're unable to overcome that stress, then we are unable to resist the stress, and then it hurts us. It hurts us physically, and it hurts us mentally, right? So we have to, again, think about ways that we can cope so that we can keep this normal resistance level kind of constant, and so our body's going to respond a lot better when we can cope in better ways. Okay? So when we think about that brain-body pathways, there are 2 pathways to handling stress and when stress happens, right? You have this initial stress response. The first thing that happens is, again, that fight or flight response. We have the amygdala, is the hypothalamus, the amygdala, all are trying to help us understand that what fear is, what's happening, and the hypothalamus is then it's triggering the autonomic nervous system. If you can remember the autonomic nervous system is broken up into two different divisions. You have the sympathetic division and you have the parasympathetic division. The sympathetic division is that system where it's getting you ready for something. It's getting you ready for fighting. It's getting ready for flighting. It's building your system up to act in a way, right? So in that system, the adrenal medulla then secretes what we call catecholamines, excuse me, and these catecholamines, these increase your cardiovascular response, your respiration, your perspiration, blood flow, activate your muscles, increase muscle strength, mental activity, so you have mental acuity. And then on the other side, the other pathway is the hypothalamus then communicates with the pituitary and the endocrine system. And with the endocrine system, it then releases a hormone called the adrenocorticotropic hormone, right? And then that is then released to the adrenal cortex, which then releases a corticosteroid. And the corticosteroid increases the protein and fat mobilization. It increases your access to energy stores, and it decreases the inflammation in your body, right? Because it's preparing your body to act. It's preparing your body to move and to act on whatever it is, either running or fighting. Okay. So again, with these two pathways, it happens almost instantly. These are automatic systems that happen. The hypothalamus is that kind of that store, that kind of that the control center. It sends information to the pituitary gland, and then it automatically starts the autonomic nervous system with the sympathetic division. After the stress response is gone or has been handled, then that parasympathetic division kicks back in, and everything that you see happening with the sympathetic is then reversed, right? So our cardiovascular system then starts to slow down. The respiration, our breathing begins to slow down. We start to calm down. Perspiration, we stop sweating. Blood flow kind of gets back and comes back into the center, right? Our muscular strength begins to decrease, and the mental activity it becomes more normal. So we go back to what we call homeostasis, back to that level playing field. So when you think about, your experience, right? I want you to think about some of those top stressors that you have as a college student. Many of you are going to say, heavy workload, studying, dealing with your peers or dealing with your classmates, dealing with professor. But again, all of those are some top stressors. Many of you might be working, so you have to find time to, to study, find time to, go to the gym. So again, these are some of the top stressors. You're dealing with your relationships with family, friends. All of these things can be top stressors. Financial burden, how are you going to pay for college? A lot of these are some of the top stressors that college students experience. And so what are those for you? And then if we can identify what those stressors are, then we need to understand how can we cope with it? Do we have any coping resources to kind of cope with the stress? Do we have any other options in how we can deal with it? But again, our stressors will be our stressors, and we're gonna experience them one way or the other. So then it comes, how do we deal with it? Okay. So when we think about stress in college, according to comparecamp.com, heavy workloads, poor sleep schedule, not enough downtime, poor time management, these have all been listed as factors that may lead to academic stress, right? And so if we know that these are some of the major factors, and these are maybe some of the ones that you may have listed as your top ones, again, we need to understand that we have control over some of these, right? We definitely have control over our time management. We have control over our sleep schedule and our downtime. So time management and downtime go hand in hand, right? They're related, right? If you don't manage your time well, then you're not going to have enough downtime. And if you don't have enough downtime and you don't manage your time well, then you're not going to sleep well. And that will then lead to academic stress. 4 in 5 college students, so 80% of the college students are going to experience frequent stress, right? And so if you know that, then it's going to be on us as administration, as faculty members to understand that and create systems around our students to support them. And you have to create support system around with your own support system. You have to do your own due diligence to create your own support system to help you support your stress responses. So here are some major reasons why students were seeking counseling, right? Here are some of the major ones. These are, again, some of the major ones that I have also experienced, right? Anxiety, depression, obviously stress, academic stress, family issues. You're not performing as well in college, relationship problems. All of these students were seeking mental health counseling for all of these different topics. And many of these are common to common common to college students all over the country. Okay, so we've talked about the emotional response, talked about the physiological response. The last piece of, again, handling stress and dealing with stress is the behavioral response. And behavioral response has to do with coping. How do we cope? Right? How do we physically and behaviorally cope? Coping is any active effort to master, reduce, or tolerate the demands created by stress. Right? We're going to talk about some of the more negative. Right? So many people, they give up, or they blame oneself for some of the stressful things that happen. When you have chronic stress and you have a prolonged level of stress for a long period of time, sometimes we get into what we call learned helplessness. And this is that passive behavior, right? When we have exposure to kind of unavoidable aversive events that we don't have any answer to, right? Maybe, I'm working at a job, but I just don't have enough money for my bills, right? That is chronic stress. And when I have chronic stress, it's kind of that passive behavior. I just kind of give up, right? We also may strike out at others, right? We get really aggressive, catharsis. We get really angry. We yell at people. We hit things. We throw things. We punch holes in the walls when we get really, really angry and really, really stressed out. And, we use catharsis as a release of that emotional tension, right? Sometimes it helps. Sometimes it doesn't. If I punch a hole in the wall, then now I have to worry about getting the whole patch, right? So that creates a whole nother stress response or another stressor, right? But aggression is any behavior that, again, intended to hurt anybody, physically or verbally. My parent yells at me, so I take it out on somebody else, right? And the aggression is not always a good thing. Aggression sometimes creates other stressful situations. If I hurt somebody else, then I have to deal with the stress of trying to mend that relationship. And again, that in and of itself can be extremely stressful. Indulging oneself, right? Sometimes stress leads to, reduced impulse control, reduced self-control, internet addiction, exercise, gaming, preoccupation with sexual content or pornography, you know, sexual behaviors. When we have, high stress response, we make bad decisions. Unprotected sex, doing things that just aren't good. We drink more. We do illicit drugs that aren't good for us. Obsessive socializing, streaming shows, like Netflix. Again, we do things that aren't good for us. We know they aren't good for us. And if we go back to social behavior, we have this cognitive dissonance. So we know that a lot of these things are bad for us, but we have this tension that builds because we continue to do them because it makes us feel good in the moment. Right? It's a temporary relief to some of the distress that we feel. Okay? Other coping mechanisms that aren't always the best, right? So our defense mechanisms, with those things that are kind of unconscious, when you think about being angry with someone, displacement, reaction formation, right? We're rationalizing things, right? All of these things are defense mechanisms to try to handle the stress in a sometimes in a negative way, and other times it could be in a more positive way. But these are largely unconscious things that we oftentimes can't control until we kind of bring them to the forefront of our minds. And then we have constructive coping, right? Confront your problem directly, right? If you have a problem, try to see if you have the resources in order to handle it directly. If, I took an exam and I didn't pass the exam, maybe handling the problem directly would be, hey, I need to study more. I need to go to office hours. I need to read the textbook more. Maybe I need to get in a study group or get a tutor, right? All of those are confronting the problem directly. And again, when we can confront it, that is a really, really constructive way to handle the stress. Avoid excessive self-deception, right? Highly unrealistic thinking, right? If I'm thinking negative thoughts, that can lead to a high stress response, right? So instead of thinking, I'm a failure, no, I'm trying my best, right? And I can do better. I will do better, right? So turn some of the negative thinking, the negative self-talk and the way that we self-deceive ourselves, let's turn it into something that's a little more accurate, right? Let's reappraise the issue because again, a lot of this stuff is not as stressful as it is as we like to make it seem, right? We have this perception that things are a lot more stressful than they are. And again, when we see things in less threatening ways, that reduces our stress. And then again, just think about how we can better deal with, right? Maybe it's a breathing technique. Maybe it's another relaxation technique. Maybe it's setting goals. Those are ways. Maybe it's, getting a social support, right? Getting around people that care for you, that can help support you through some stressful events. Again, those are great ways to cope. Speaking to somebody that you trust is a great coping mechanism, right? So again, constructive coping uh, is way much better than some of the other ways that we talked about before. So here's just a check. We talked about those two pathways. We talked about the pituitary gland. We talked about the hypothalamus and how it then leads to the autonomic nervous system. And they have certain things that happen. So it says in times of stress, it says the brain sends signals along two pathways. It says which pathway controls the release of corticosteroid hormones, which increases energy and prevents tissue inflammation. Okay? If we think about the two pathways, I can kind of visualize the diagram that I showed you before. On the left-hand side was the pituitary gland. On the right-hand side was the autonomic nervous system. And there was a big list of increasing perspiration, respiration, all of, heart rate, cardiovascular, mental activity. And then on the other side, you saw increasing protein, fat, and then reducing inflammation, right? So you should have selected pituitary. All right. So how do we handle stress and our physical, right? Really, really important. The effect of stress on our physical health has been studied forever, right? Over the course of time, if we aren't able to cope with stress in a positive way, prolonged stress responses lead to negative effects and long-term effects on our mental and our physical health. And we'll talk about a few ways in which that can occur and happen. Okay. Our personality plays a big role in how we experience stress, right? And how susceptible we are to the stress response. Okay. So most people know that, again, high cholesterol, high blood pressure, obesity, smoking are risk factors for heart disease. But think about our personality type. Think about someone who is more neurotic or someone who is more outgoing, more extroverted, or think about somebody who just, is more relaxed and laid back, right? So think about someone who is highly irritable, someone who is always anxious, always thinking the worst. They're probably going to have high blood pressure, likely going to probably do things like smoke because they're more anxious, and that's going to put them at more of a risk. So a type A personality, you identify three elements, right? This person is going to be more competitive. They're going to be more impatient and time urgent. They're going to have more anger and hostility, right? As opposed to someone who is a type B personality, they're going to be more relaxed. They're going to be more patient, easygoing, and have more amicable behavior. So they're not going to be angry and hostile towards people. They're going to be a little more easygoing, a little more forgiving and gracious towards people, right? These two different personality types play a big role in how our body responds to and stress. And that stress response then talks about how we might develop some certain diseases like high blood pressure, high cholesterol, and other heart and other diseases in our body. Okay. So there's a reaction that we have with our different personality types. And brief periods of mental stress can trigger sudden symptoms of heart disease, right? When you think about heart disease, we're thinking about a lot of issues that are occurring around the heart, right? So when people get really, really angry, right, more frequently and with more intensity, they're at higher risk. Have you ever seen a movie where, you got a parent who's yelling at his kid, who's really upset, he's really, really angry, and then he holds his heart because he's he's going into cardiac arrest, right? He's having a heart attack, right? That anger has a way of, again, creating heart disease and heart attack. And it's not a good thing, right? Also, depression, those who are a little more neurotic, that also is a risk factor for heart disease, right? So any emotional dysfunction, um, any kind of depression, kind of roughly doubles our chances of developing heart disease. So it's important that we deal with stress in a healthy way, with healthy constructive coping mechanisms, so that we can mitigate some of these factors. We can't really change our personality, but we can change the way that we cope with stressors. You see this on the left-hand side. Those who have kind of a low anger level, they have a low relative risk for coronary events like heart disease, heart attacks, right? Whereas those who have high anger levels, they're going to be the ones who, again, have the highest relative risk for coronary events or heart risks, right? So we have to be mindful of that because our heart risks, that physiological response, um, when we have a heightened level of anger and hostility, it's going to lead to higher levels of disease, whether it be heart disease, high cholesterol, um, or any other disease that may cause issues in the body. Right? When you talk about high stress response, when our stress response is really, really high for a prolonged amount of time, our immune response is affected, right? So if we're chronically stressed, a lot of hormones are being released in our body. Um, our body is then trying to fight off things that it just doesn't have enough energy to do, right? The immune response is just what we call a defensive reaction to the invasion of bacteria, viral agents, or other foreign substances, right? So studies do show that those who have uh, high stress does suppress the immune activity in humans, right? Those hormones that could be used to help heal us are actually hurting us, right? And so when you have exposure to long-term stress, it can, again, promote chronic inflammation. Again, with chronic inflammation, that is recognized as a factor of heart disease. And chronic inflammation can also be contributed to arthritis, osteoporosis, respiratory diseases, diabetes, Alzheimer's disease, and some types of cancer. So we have to be mindful of, again, our stress response, right? How are we coping? Because again, we know that stress is going to suppress our immune system. That's why when you get really, really stressed out for a long period of time, you feel exhausted, and then eventually you get sick because again, your immune response has been suppressed. And again, we want to make sure that our immune response, we need more sleep, we need to eat, and again, we need to get in and constructively handle and cope with stress. This is just showing the correlation of the relationship, right, with high stress and incidence of illness and personality, right? So when we think about personality type, right, physiology, memory, we talk about neuroticism. Those people who are more neurotic or are higher on the neurotic spectrum, again, they are highly irritable. They're really, really anxious. They are oftentimes going to complain about more things that are happening in their life, right? And so, again, that's going to lead to high stress. They're higher stress. They're irritable, right? Also, when you have a higher personality, high neuroticism, then you have a high incidence of illness, right? This is just a relationship, right? It's not saying that one causes the other, but high stress may cause high incidence, right? It suppresses that immune system. But again, the mediating factor is our personality type, right? Are we more laid back? Are we more of a type personality B? Or are we personality A, type A, right? We need to determine who we are, right? And then if we are type A, how can we best mitigate the effects of, our personality type? Can we use constructive coping mechanisms in order to kind of reduce the stress level and then subsequently incidents? Okay? Here are some ways that, again, even if no matter what your personality type is, these are some ways that you can moderate your stress level, again, you need social support, right? We talked about those constructive coping mechanisms, but social support that that those people around you that can help support you and talk to you, help encourage you, those are those individuals or persons that can help you and aid you in kind of mitigating those stressful or the effect of stress on you, right? It shows that there are favorable effects of social support, and they are strong enough to have an impact on mortality, increasing people's odds of survival by roughly 50%, right? So people who have greater support systems usually live longer than those who do not, especially when we hold uh, these individuals constant, right? So think about two individuals growing up in a very impoverished area. One doesn't have social support, the other does. Again, their survival odds for the person who does is higher, 50% higher than those of that person who does not, right? So we want to make sure that we do develop social support systems and those social networks so that we have an opportunity to mitigate the impact. Okay. When we talk about social support, there are some cultural differences in how we identify social support, right? Americans prefer what we call explicit social support, right? Those are those kind of overt emotional solace, um, instrumental in aiding aid from others, right? We need if I'm struggling to pay my bills, I need somebody to help me, right? With a check, or if I'm really really down and really really sad, I need somebody to come console me, tell me that everything's going to be all right, sit with me, talk to me, talk me through. Okay, with the Asian culture, they prefer more implicit social support. Implicit social support is that comfort that comes from just knowing you have access to close others who will be supportive. You don't necessarily have to have them there, but you know that they are in the midst. I have more of and feel that I have more of an implicit social support system, right? I think about my social support more implicitly. I know if I needed them, that I could take back and have. I don't necessarily have to call you, but if I know you're there, I know I have access to you, then I feel comfort and have comfort. Right? Other factors that kind of moderate the impact of stress is how we handle kind of our personality types. Talk about the big five factor: uh, openness to experience, extroversion. You talked about conscientiousness, uh, neuroticism, right? Extroversion, introversion. What else? What else did I miss? Um, Optimism, right? All of these are those big five factors, right? When you talk about those big five factors, certain traits are and can moderate our stress response. Optimism is one where if I'm more optimistic versus pessimistic, right? If I'm more optimistic, then I have more of a rosier view of what's happening, more positive view. My stress level is going to be less, right? If I'm more conscientious, right? Being more conscientious is associated with good physical health and increased longevity. I'm going to make sure that I get more sleep. I'm going to make sure I do more time management. I'm going to make sure that I'm more organized so that I don't create high stress situations. Sometimes, as someone who has a habit of procrastination, I create stressful events for myself and stress for myself instead of going ahead and doing it. And I knew it would reduce my stress level. I wait, right? More people who are more conscientious also are less likely to kind of exhibit those unhealthy habits like smoking and drug use. Social class disparities, right? So if I have higher income, that's a moderating factor, right? Crowded housing, pre-existing medical conditions. But again, on the flip side, again, if I'm living in a more supportive environment, or maybe I'm living in the suburbs, single family housing, I'm more healthy. I don't have pre-existing medical conditions. If I have the social class is a little lower, then I'm probably going to experience more stress than those who have higher social status. Right? We've talked about the negative, right? But there's also a positive effect to stress. Okay. And I think stress, just like anything, like change, and pressure and frustration, all of those things aren't always bad. Being frustrated is not always a bad thing. Sometimes I'm frustrated with how I perform on an exam, right? But that frustration is giving me a motivation to perform better on the next one, right? And when I have a stressful event, resilience then becomes something that happens, right? It's a positive effect of stress. Okay. Stress can promote personal growth, right? I have a stressful event happen to me, maybe it's a challenging event. I'm encouraged to keep going, to self-improve. Maybe I again didn't do so well in the exam, but I know I can do better. So the next time around, I study a lot longer. I I don't cram the night before. I do things that are going to help me um, make it to the finish line and get the grades that I want. Again, when we talk about positive effects, there's an adaptation process. Stress can lead us to personal changes for the better, right? And then when you grapple with stress, it can build resilience to face future stress, right? So when I was in undergrad, my freshman year, and I had those really big stressful events, I grappled with a lot of the stressful things that were happening in my life. When I got into graduate school, I had so much stress in undergrad that when I got to grad school, it wasn't that bad. I was able to kind of face future stresses in a different way. And my perspective had changed. My mindset had grown, and my capacity to handle stress had gotten a lot better. So again, we need stress. We need that resistance in our life sometimes to help push us and help us to grow to bigger and better heights. Okay. So we've talked about kind of the negative stress. We even talked about some of the physiological responses too. But then when we cope, there are some ways that we have what we call health impairing behavior. And health impairing behavior, those are the things that we do that we know aren't good for us, that we continue to do because they make us feel better in the moment. Right? Some of those things might be smoking, alcohol, drug use. But again, a lot of this stuff is tied to how we cope with some of our stress. But when we think about someone who smokes, right, smokers have a shorter life expectancy, right? They live 10 years less than non-smokers. 67% of smokers die from tobacco-related diseases, uh, cancers, throat cancer, lung cancer. Secondhand smoke is extremely detrimental. It can be as detrimental and harmful to those who are receiving secondhand smoke than those who are smoking, have firsthand smoke. And then heavy alcohol consumption and use of various recreational drugs increases the risk for disease, right? So all of these are ways in which we impair our health. Um, Again, we think that, physiologically that we're not being harmed, but on the inside, things are happening on the inside, and psychologically, things are happening that can and have long-lasting effects. When you think about people who do smoke, um, as the educational attainment increases, those who smoke begin to decrease. And that might be because, their stress level is down. Those who do smoke usually smoke because they're trying to cope with some type of stress. Many times people smoke because it feels good, but it's a way to release some type of stress, right? They're trying to make themselves feel better because of some type of anxiety or stress that they feel. So those who have graduate degrees, they may have a better job, less stressful job. They have better income, and so they may not have to smoke as much because again they're less stressed. Um, and again, that's kind of the social class index, right? Those who have lesser income are going to be higher smokers versus those who have higher income, or lower income versus higher income. Those who have higher income don't have as many health impairing behaviors. The lack of exercise. Oftentimes, when we get really, really stressed out, that leads to anxiety and depression. But with sedentary lifestyles, it just creates this perpetual cycle, right? When you have a sedentary lifestyle, it increases the risk of chronic conditions that, cardiovascular disease, diabetes, obesity, hypertension, more, right? And when you see those things, right, um, there's everything is tied to one another, right? So if I were to kind of handle my stress response, then maybe I wouldn't feel as depressed and anxious, right? And if I am not feeling as depressed and anxious, maybe I have the motivation and energy to go exercise or to have or increase my physical activity, right? So when we think about physical activity is anything that gets your body moving. Physical activity can be uh, vacuuming your room, washing the dishes, uh, walking to class, all of that is considered physical activity. Exercise is going to the gym. You have pre-workout, you have a regimen that you follow. That's your exercise. You're going to run on the treadmill, you're going to lift weights in the gym. Again, all of those things is considered exercise. The benefits of exercise are, we know, right? Reduces physical effects of stress, obviously. The more you work out, the more you're able to handle stress, enhances your cardiovascular fitness, um, reduces your risk for obesity and health-related issues. But again, we know, right? It also reduces the cognitive decline. We exercise at a higher level. It reduces cognitive decline because, again, our hormones in our body are being released, and it's creating this balance in our hormones in our body. Okay. Sexual behavior and sexual transmitted infections, STIs. Again, tied with stress. When you think about coping, right? Oftentimes, when you're in a high stress situation, chronically stressed, we talked about the impulse control, self control dies or reduced. We make worse decisions, right? We make sexual decisions where we don't use protection. We sleep with more people to try to reduce the amount of or the tension and the stress that we feel. And these, again, are unhealthy coping mechanisms, right? We try to distract ourselves from life, stress, body issues, relationship issues, and it oftentimes can lead to things that we don't want, right? STDs, herpes, human papillomavirus, gonorrhea, chlamydia, some of these things can be cured, others cannot, like herpes, can't be cured, right? And so you don't want to go through situations where you have to put yourself at risk. Pregnancy, right? Unplanned pregnancy. Those are things, again, that we can't take back, right? And so, or cure. And again, stress response is extremely important. We have to be mindful of what we're doing so that we can, again, level ourselves out so that we make better decisions and improve our impulse control by, again, coping with stress and health. Okay. If, in fact, you are needing, to develop some better coping strategies, here are some ways to do it, right? Getting enough sleep, eat well, right? But more often than anything, if you are struggling with mental health issues, right, and need help managing your stress, we have free services at the Health and Counseling Center. And many health and counseling centers on college campuses are underutilized. And these are free services offered to you, right? They are there for you. They are there to help you cope with some of the things that, again, you might be dealing with, right? Family issues, um, financial issues, relational issues, heavy workload. All of these stressors, again, affect your physical and your mental health. And if you're not operating at an optimal level, physically or mentally, your academic performance then begins to decline. And we want you to perform at your highest level, because when you perform at your highest level, then it creates, a better outcome academically, higher GPA, better prospects for jobs, higher income, less stress, less everything, right? So that's what we want, right? Don't rely on stimulants. Don't rely on coffee. Set realistic expectations, right? One of mine is avoid procrastinating. Get things done when you need to get those things done, okay? And then identify just stressful outlets, healthy stress outlets, right? Identify those. Spending time with family, breathing techniques, mindfulness, all of those are really, really, really helpful in helping to kind of cope with stress. Okay. All right. So reactions to illness, right? How do we make a decision when we wanted to seek help, right? Many people delay help, right? Due for illnesses due to various things, right? Maybe it's I don't know. I don't know where to go. Maybe, or maybe it's I just downplay the significance of my symptoms. I don't feel like I have an issue, right? I have, maybe I have mild depression. I don't feel like it's a big issue. I can't get out of bed. I don't want to get out of bed. My energy's low, but I don't want to go get help, right? Maybe you're worried about, it kind of disrupting your plans. You don't want to have to go to an extra appointment, right? But again, these things are really, really important. Your physical health, your mental health is extremely important. I have when I was growing up playing sports, I was hit in the face with a baseball one time, right? Throwing bat in practice. I threw the ball. He hit the ball so hard, and I couldn't even react quick enough. Smashed me in the right side of my face, fractured my cheekbone, right? My mom comes and gets me, and we don't go to the ER right away. She's like, you know what? Maybe it's just just swelling in my face. And so it was like, just put some ice on it. And that night, I just was in complete discomfort and pain. And that next morning, she was like, you know what? Let's just go to the ER. And it found out that my cheekbone had been fractured, right? So it wasn't that it was going to be a waste, right? But she just thought it's just swelling. It's a trivial thing, you know. We'll just try to handle it our own before we go. But again, seek treatment if you need it, right? Seek treatment for physical things and also seek treatment for mental things. Because again, when you downplay things, when you think you're going to look silly for, you know, maybe it's nothing at all. Maybe you have a headache and you think it's something bigger than what it is. Just go anyway, especially if it's a free service, you have insurance, go, right? If you're struggling with depression and anxiety, go seek the help. Seek the help because it can help you in the long run. When you're going to communicate with a provider, right? When you go into your health provider's office, there has to be some quality communication, right? Ask questions if you need to ask questions, right? If your provider is saying something that you don't understand, ask for clarification. Don't wait. Ask everything. Be as honest as possible when you're communicating. Right? They ask you some questions like, "Hey, have you used illicit drugs in the last 10 days?" Say yes if you have. Right? If they ask for the number of partners that you had in the last 5 days, then answer as accurately as possible because that information between the provider and the patient is extremely important for your treatment and how they can treat you. Right? So don't be evasive. You know, if you need to answer a question, answer it because again, your diagnosis and when you're diagnosed, it can help again mitigate some issues and long term effects of maybe some diseases that you might have that you could again better treat with medication or some type of intervention. Right. So again, and sometimes if you don't believe that they're diagnosing you with something that you don't really believe, then challenge your doctor or go get a second opinion. Right. Make sure that you're doing your due diligence so that you're making sure that your health is a priority. Right. Your health outcomes are extremely important and can be improved if you again communicate very well with your health provider. And again, actually go seek help when you need it. Ways to improve communication, obviously, just be accurate, be candid, ask for clarification if you don't know something like I talked about before. And if you have some questions beforehand, go ahead and put them in a note, right? Write a note out to yourself. So in advance, so when you go on your medical visit, you can ask the particular question that you have, right? So for expecting moms, if you have questions about, what's going to happen in my first trimester, or my second trimester, what should I expect? Those are questions that you should go ahead and ask, and don't rely solely on WebMD or information that you find on the web. Ask the provider right there. You're paying them for a service, and since you're paying them, go ahead and ask the questions you want. Don't leave out anything. Don't leave any stone unturned. Make sure that you're really you're really intentional about again getting the help that you need and asking the provider for every mention. Okay. The last one is really important. When you think about the history of brown people in America, sometimes we should voice our concern when we feel like something's not being done well, right? And again, that goes again back to maybe getting a second opinion. Um, we have a higher mortality rate for women who are giving birth, and a lot of that is we have to be more cognitive. We have to voice our concerns, right? If we don't feel like we're getting enough treatment, we don't feel like we're getting the pain medication we need, we have to again look at the system and look to see what's happening. Right? Is this a systemic thing, or is it an individual thing? And I believe it's a systemic thing that we have to check. We have to look at the suitability of our treatment, We have to look at the feasibility of the doctor's recommendations. So again, if I'm in pain and the doctor's like, you'll be okay. No, I need the pain medication so that I can mitigate some of the long-term effects of that, right? So again, make sure that you are communicating effectively with your health providers. Okay. One other thing that we have to do is when we do and are diagnosed and they prescribe us something, adhere to the medical advice, right? If the doctor tells me I broke my arm and they tell me to keep the cast on for 6 months, keep the cast on for 6 months. There's a reason why they told you to keep it on, right? So yeah, your arm might feel good, right? But don't take the cast off before it's time to take the cast off. Adhere to the the advice, right? Start the treatment on time. Don't stop the treatment too early, right? When you don't take the medicine, you don't take it for as long as you need to, sometimes it can hurt you, right? If you're taking something and you're having some negative side effects, yeah, take it, but also go to the doctor to see if they can prescribe you something else that might help, right? Be consistent in following the treatment procedures because following them can be the difference between you having, um, you know, the length of your recovery period being either really, really short or being extended out, right? So if you take that cast off too soon, then you might have to put another cast on because you re-injure it in a way because your bones weren't healed as wholly as they should. Okay. Some other non-compliance reasons: people forget, people aren't supported socially, lack of understanding of the instructions, and that's why again communicating is really important. If you don't understand an instruction for a particular advice, ask. Right? If the difficulty of the instruction level of the instructions is too difficult, ask. Right? And this is another thing. Right? If you think about the Tuskegee experiment, the simplest thing, right? There are individuals who just don't trust medical providers because of the distrust and the negative attitudes towards physicians, right? That is a thing. So maybe it's going to be really important. It's really important for us to have representation, excuse me, in the medical field, so that we'll be more trusting and have a more positive attitude of the physicians if we know that they live like us, right? I have a Black African American male as a physician because I know and I trust him. I have a more positive attitude towards him because I believe I have a belief that he understands my experience being a Black man. Right? Again, that is something that we need to do. If we don't have a positive attitude towards our physician, then let's find a physician that we feel comfortable with. Just like seeking mental health help, right? You can choose your counselor. If you want a therapist who is Black, female, and heterosexual, then you can do that, right? If you want a Black female who is homosexual, then you can find that. If you feel more comfortable with those individuals, if they match your characteristics, again, find those individuals who can help you so that you can, again, adhere to that medical advice that you give. Okay. The last thing we'll talk about are just those things. We always talk about it. Stress has only a modest impact on physical health, right? That is true, but it can make a big difference in other factors that contribute to it, right? Our, again, personal experience about stress is subjective. Obviously, things that might stress me out may not stress you out, right? As a professor, teaching and speaking in front of people is not always that stressful. For people who don't do it as often, it may be very, very stressful, right? But again, the impact of a stressful event, we could be in the same room, experiencing the same stressful event. My point of view may be different. My personality may be different. I may be a little bit more easygoing. You may not be. And so you might respond in a very different way. Here's a question, kind of a nozzles check. It says physical health can be influenced by a variety of variables, including our personality, health-related habits. It says which type of factors in health include personality and health-related habits. Okay? If you're thinking about personality and health-related habits, you should have selected C, psychological. So again, our physical health, our personality is really psychological, the way we think. And again, that those variables are related. Our health-related habits, habits are related to, again, that psychosocial or the psychological, right? So those are kind of our determinants of health. And the psychological is a big part of how we manage our health uh, and our physical health response and our mental health as well. You don't have to do this, but I want you to think through identifying those causes of stressors in your life. If you can identify them, then I want you to think about the consequences of those stressors, right? And then what can you do to better manage it, right? If you know that you have a habit of procrastination, then what can I do? If procrastination then creates stress, then I know that I can change some things in my environment to help better my stress level because I know that procrastination, I can stop procrastinating. That's one thing that I can stop. Doing things, setting goals, those things can help me to better manage my stress. But here's just a summary, right? Impact of minor stressors, right? A summary of one, right? There's several. Okay. And then three. But again, as in conclusion, right? Stress is inevitable, right? Wherever you are, you'll never be able to escape. The one thing that we can do, however, is we can control how we deal with it, right? We can control the mechanisms that we use, the coping mechanisms that we use. We can control our habits, our health-related habits, like eating, getting enough sleep, avoiding procrastination, time management. We can handle those things. We can control those things. If we don't think we have enough money, that's creating enough stress, creating stress. Then we can get an extra degree. We can try to find a better job, right? We can take control over situations. Now, if there are things that we don't have control over, then we have to think about ways that we can cope with it, right? But if we have control over it, then that's how we can go about it. We can, again, tackle the problem right on, right? Problem-focused solutions. Let's find solutions to problems that can mitigate and moderate that stress response, okay? So, again, there are some coping mechanisms. Think about what you can do to manage stress. And when you find those things that work for you, because no stress coping mechanism is one size fits all, right? There are some things that might work for me that may not work for you, but find what works for you. And when you find what works for you, do that, right? Because your long-term health is at stake if you don't catch and are able to monitor your stress response and handle stress in a more positive way. Okay, so we're going to end there. I hope you all have a great evening. Thank you for tuning in. We'll see you for the next lecture.